The State Health Officer, Dr. Thomas Dobbs. Good morning, sir. How are you?
Good morning. I'm great. Thank you.
You get any rest over the weekend?
I got some good rest.
Did you?
Yes. Between the rain bouts,
Can you ever get away from it?
No, I guess you get used to anything after a while.
The way it looks across the country, I mean, around the world, as a matter of fact, is most of this attributed to the Delta variant?
In the United States, it definitely
is here.
Yeah, without a doubt. I'm not sure about every other part of the world, but in Mississippi, it's almost all Delta variant right now.
When let's go first of all to what we look like. I think the COVID cases in the latest report, 534 new cases. Is that a single day?
Yes, sir. That was a single day, and this morning we're going to report out through the weekend 3 times the number of cases we had last weekend.
Really?
Yeah. It's getting pretty
for
rough.
a 3-day total.
Yes, sir.
Average out to what?
About 800 a day.
And is that coming from any particular place in the state, or is it just across the state?
It's all over. We have seen a pretty, northwest part of the state. DeSoto County's been hit real hard. They kind of account for a majority of a large number of our cases. Yeah. But it's really spread out all over.
As far as you know, and I know that you try to get some data on this to see what the trends are and where we're going with it. What's your analysis of this as far as who's getting it, who's not getting it, age, people who've had the vaccine? What does it look like?
It's all age groups, but we're seeing a lot of growth in sort of children, teenagers, and then young adults because summer's opened up. We know our vaccination rate, our immunity rate's really low in that group of folks. We know that, of our kids who are under 17, only 72% have not had it already. Yeah. So those folks are all 100% vulnerable. And so it makes sense it's spreading. But we're also seeing transmission to older age groups. What we've seen is a phenomenal surge of healthy or mostly healthy 40-year-old folks in ICU, on ventilators, and dying. And we're also still seeing 65-year-old folks on ventilators and dying.
Is the death rate up?
It's starting to increase. It usually lags about 2 to 3 weeks because it takes that long for people to be on ventilators before they start passing away, sadly. But without a doubt, 93% of our deaths are unvaccinated. 96% of our cases are unvaccinated. I mean, it really is an unvaccinated situation, sadly.
So have we seen some, is there enough data from the people who've had that secondary shot to say, okay, some of these people have gotten the Delta variant, have gotten COVID once again, but they've weathered through it thanks to the vaccination? Is that something that you can collect enough data on yet?
Yes, sir. It does look like, if you look at the hospitalization rate versus the deaths, we are seeing a spread where people who've had the vaccine get over it. One of the things that's tricky about Delta, it looks like if you've had COVID like last year during the initial surge, that your previous natural immunity isn't that great. But the vaccine actually, fortunately, is better than the natural immunity people have.
Is that something from the CDC to the point of where just because that the immunity through having COVID is not working?
Not as well as for previous strains.
When you say not as well, I mean, what's statistical?
It's hard to say. Most of this is through scientific studies where they look at the neutralizing antibodies. So it's really more of a qualitative than we can put quantitative right now.
When you talk about kids, one of the things in the new guidelines that you did, and on Friday the Mississippi State Department of Health released some new updated COVID-19 public health guidance for K through 12. Talk about that.
Y'all, we've got to get kids in school. We've got to have a successful school year. Our children have really paid the price for not being able to get good instruction. So, what we've learned is there are ways to do this safely. And if kids are vaccinated, we feel really good about them in structured settings, not wearing a mask and not having to quarantine if they're exposed. But then kids who are not immunized, we know that if we can separate them 3 to 6 feet and have a mask on and, be careful in these sort of extracurricular settings, that there really is very little minimal transmission in those sorts of environments. So we have structured hours similar to the CDC, but also aligned with our isolation and quarantine rules for people who are exposed or who are sick.
You think we have that many 12 years old, 12, 13, 14, 15-year-olds that have been vaccinated?
No, we don't. Only about 6% of that population's been vaccinated.
So the problem is, with the guidelines, is you're strongly suggesting they get vaccinated before school starts.
Absolutely.
And now we're mid-July, so we don't have long.
And we are offering in all the county health departments. We've been excited to see that our county health department vaccine appointments are filling up. which is great. And so, go to your pediatrician. But, all county health departments will have vaccine available for kids this week.
Because by the time they take that second one, they're going to be real close to school starting.
Absolutely. So there will be some period of time where probably a lot of kids would need to be wearing a mask.
Let's talk about that. Masks should be worn indoors in school settings by all individuals aged 2 and older who are not fully vaccinated. So does that mean that the mandate is going to be for all the kids when they go back to school to have the mask on?
Yeah. Well, this is our public health guidance. Now, there will be some flexibility. Obviously, the school districts have a lot of autonomy here, so we're working closely with them to try to align them with our guidance.
Is there any, as far as public education, when you talk or work with the Department of Education, for there to be not a mandate, but strongly suggest that the teachers and the administration get their vaccines? How many people there that haven't been vaccinated?
It's the majority have not been vaccinated.
The majority of
teachers
and administration have not been vaccinated.
Yes, so they're kind of like the rest of our state. We don't have exact numbers for every school, but we do know that it's the majority.
Schools should maintain at least 3 feet of physical distance between students, with classrooms combined with indoor mask wearing by people who are not fully vaccinated to reduce the transmission. Have you seen any negative effect on kids who, let's say, are 12 years and up? As far as the vaccine is concerned?
We really haven't. Of course, you can rarely have a side effect for any medication.
Yeah.
Within, not really kids that age, but we've seen like older teenager and I think a young adult who had myocarditis. Out of the more than 1 million people who've been vaccinated, we've seen a couple of cases and they seem to recover without
swelling of the heart?
Yeah, it's inflammation of the heart, but it seemed transitory and mild. The thing that's part of this is if you had it, you would need to sit out of sports for a while. It's just as a safety measure. But please know that the rate of myocarditis from COVID is many-fold higher than that because COVID commonly causes myocarditis.
So you don't get that information. All of a sudden you hear, my God, my 12-year-old is going to have this, and he's going to have he or she's going to have a swollen heart, and it scares the bejeebers out of you.
Yeah, we've become too numb to the dangers of COVID, and then the fear factors are overplayed.
When you have a salacious or really tainted soundbite, it travels at the speed of light. And by the time it ends in the other part of social media, you don't know what it is. But that is true. Schools should continue to isolate COVID-19 infected students, teachers, and staff, and continue contact tracing to identify exposed individuals for quarantine. What would your suggestion be next if you have to step this up again?
Boy, I sure hope we don't have to do anything. I mean, right now, I think it's important for people to take responsibility for themselves and be safe. I mean, Delta's pretty bad right now. We did recommend that older folks or people with chronic medical issues go ahead and sort of lay low for a few weeks until this wave passes. Mostly avoid indoor social gatherings because we're seeing a lot of transmission in weddings, social gatherings.
Segment here from Dr. Thomas Dobbs, State Health Officer, live in the Trustmark Studios. I think one of the reasons that we are more applicable to the vaccines themselves, we've gone through kids and grandkids, and we've seen this as far as the mandate in schools, the vaccination program. But also, we came up through smallpox. We came up through polio. We know people who have died. We know people who've been, for life, had to deal with the after effects of polio. So I think we look at vaccines in a little bit different way. At least some of us do. And I did want to ask you this. Speaking of the vaccines themselves, though, if you were giving to your 12-year-old and up, do you have a recommendation as far as which vaccine you would ask for if all three are there as the state health officer?
To be honest, we are far more enthusiastic about the Pfizer and the Moderna. And the reason is, the efficacy is better as far as getting the 2 doses. It looks like, you're preventing illness for that age group almost 100%, which is amazing.
Yeah.
But, the few bad side effects that we've seen, to be clear, we have not been able to verify a single death from COVID vaccine, but we've had almost 8,000 deaths from COVID. Of course, some people are going to die, randomly within a week or two after it. But with the Johnson & Johnson, we haven't seen it in Mississippi, but there are reports of this weird blood clot thing, and then there's also reports of Guillain-Barré syndrome now. So, Pfizer and Moderna seem to be our workhorses.
And those are few and far between, but then again, they're there.
Right. And it's not as effective. So, I mean, if you just put those things together, Pfizer and Moderna seem like a better choice.
And all of them are available across the entire state.
Yes, and if you go to vaccines.gov, you can actually select what vaccine you want by location.
Let's talk about the booster dosages. Is that a possibility as far as some of the people with immune situations?
Yeah, we are strongly recommending if you have immune compromising conditions, cancer patient, if you're on medications that weaken your immune system or transplant patient, please talk to your doctor about a booster dose. We do know that people with weakened immune systems don't respond as well to 2 doses of vaccine, and we do know that there's data that a 3rd dose can boost you up. So please talk to your doctor about a booster dose. We're going to try to make those more available, and we'll hopefully have a mechanism for booster doses at the county health department if your doctor makes a referral.
If you have a student, regardless of what grade it happens to be, 12 years old and up, and they have been vaccinated, could they not wear the mask, or would they have the privilege of not wearing a mask in school?
They would have the privilege of not wearing the mask in school and also not quarantining. So quarantine is after you're exposed. It doesn't mean you're infected. It means you're exposed. And one of the most disruptive things would be, if Susie's sitting next to Josie on the bus and she's exposed, well, she needs to sit out for a week to 10 days. Yeah. Well, if you're immunized, you don't have to sit out. So it's going to be less disruptive to our learning.
As a reminder, you put it in here that fully vaccinated students and teachers and staff don't have to wear a mask when indoors, do not have to be quarantined or be excluded from school settings if they have the COVID-19 exposure, and don't have to be tested unless they are symptomatic. Are the early symptoms of the Delta variant, do they differ from just regular COVID-19?
The symptoms don't seem to be very different that we can tell. The Delta variant is it's like twice as contagious as the previous variants we had, like the Wuhan strain. So that's the thing that's really making all the difference.
But again, even if it's more contagious, I've heard anywhere from 70 to 90% more contagious, are the symptoms the same basically as, in other words, could a lot of people still asymptomatic? They don't even know they've got it.
Probably.
Is the smell test the same thing? They're losing taste or smell?
We are still seeing folks lose taste and smell with the Delta. There is some possible observation of increased mortality from Britain, but I think that's still sort of up in the air. We don't know for certain.
What else do you want us to know while we got you here? Because this thing is a moving target. When we mentioned this before we left for the break, and I wanted to ask you this, could this evolve into something else, morph into something else?
It certainly could, and the best way to prevent new variants, new mutants, is to suppress transmission. Because it's like rolling the dice. It sort of mutates spontaneously, and just randomly over time it'll find a pathway that makes it more contagious, more deadly, whatever. Yeah. And if we prevent transmission by being immune through immunization, then we cut off those avenues through which it can attain new variants.
Sometimes you get the idea that it's almost like a living, breathing enemy that's intelligent enough that it knows what it's doing. Is there any truism to the fact that the more it is suppressed, the less it's trying to hip-hop or hopscotch to another one and doesn't find a host, that it begins to intelligently evolve into something else?
The less it can spread,
right,
the more likely it's going to fade out.
Just fade out. It's got to jump somewhere.
Right. It's got to has to have an opportunity to go to somebody.
No recommendations as far as fall football right now coming up?
Outdoors is pretty good. We got to be extra careful for like those bus trips and things. We do recommend that sports teams especially do weekly testing. We have a mechanism where schools can have a weekly screening test to try to keep kids healthy. We do know that reduces time out of school and minimizes outbreaks. And then one more thing I'd like to mention, if you don't mind, is one of the tools we have in our armamentarium are the monoclonal antibodies. I know we talked about that before. So if you do get COVID, if you have any medical issue whatsoever, please call your doctor about getting monoclonal therapy. We know it'll reduce your risk of hospitalization up to 89%, and we know that it'll reduce your risk of severe illness and death. Most of them are free from the federal government.
Is that an injection or is that a cocktail or something of that
It's an infusion. Takes about an hour, and we have a network of hospitals. We have like 30 hospitals around the state that are participating in our COVID centers of excellence and a couple of clinics.
And it takes how long?
An hour.
About an hour?
Yes, sir.
Is hydroxy a part of that?
It's not. I know people are really interested in hydroxychloroquine and ivermectin, And I would like to emphasize, we don't keep people from using it. I don't think it makes that big a difference, but we don't keep doctors from doing it. But it should be an and, not an or.
What's inclusive? What is this made up of? This infusion made up of?
It's made up of antibodies that are designed to bind and kill COVID. It's the same stuff that Trump got when he got sick.
I got you.
Yeah.
Always appreciated, sir. So very, very much. You did say when the new report comes out a little bit later on this morning, it's going to be how many?
It's going to be about 3 times the number we saw last week. So it's going to be up.
So we're going to be in the triple digits, or in 4 digits on this one.
Well,
over 1,000.
Yeah, over 2,000 for the
over
weekend.
2,000
for the weekend, yes,
weekend.
Sir. Yes, sir.
Deaths. You know what the number of deaths were?
I don't know what the number of deaths is yet. Yes, sir.